There can be several reasons for a spike in blood sugar. It's a good idea to know what is causing yours, but at first it's essential to understand what A1C and what the A1C test actually measures. Before you start overanalyzing your results, remember that there are variables at play. If you're not eating right, you're going to have problems all over in your body. And the spleen is just one of the things that are going to suffer downstream from what you eat. A lot of doctors are still doing functional medicine. They call it functional medicine, doing blood test analysis. And I'll bet if you had every one of your patients do an A1C, you'll probably find 60, 75% of them are borderline or they're diabetic and they don't even know it. I mean, one of the best ways to test for that is to say, how many times you go to the bathroom in the middle of the night? Oh, one or two. Well, they're pre-diabetic or, they have some blood sugar imbalance, and that's why they're having to urinate throughout the middle of the night. So again, you can kind of see some numbers here. You want to be below this, 6.5 in the green zone, but then when you get into the yellow zone and then the red zone, it's not good. And I know what it feels like. I've been there, done that, and I know what works. How about that? Now, how can you treat that within your office? Because if your patients have diabetes or blood sugar imbalance, they're going to have more inflammation, more pain in their body, and it's going to be harder to keep their pain levels down, as you treat them. So I've developed programs not only for just pain management, healthy weight loss, neuropathy, diabetes, but just a better lifestyle living. So there's different things you can help change, and don't reinvent the wheel. We have ways to make you talk. We have ways to train you so you understand what's going on. Now, patients a lot of times are worried that they're at risk for diabetes because high blood sugar levels, on their A1C test. And if you ask a lot of patients, well, have you had an A1C test? They're like, yeah, I have. What is it? And even you can spike even when eating healthy foods like apples and pears and fructose. Fructose can also spike blood sugar in the body. In fact, a lot of the glucose is made of fructose, and the liver processes fructose. And if it has too much fructose, this is what causes a fatty liver. So while high blood sugar is a common sign of diabetes, it's not exclusive to those with this health condition. In fact, people often encounter high levels even though they don't have a history of diabetes. And so I always ask them, did your parents have diabetes? No, they didn't. I said, well, congratulations. You are the first person in the family to develop diabetes because of the diet, because of the dietary, what they do. So we want to make sure that we're getting tested and then start eating well. In fact, they have the glucose monitoring system that you actually can put on your arm or wherever you want to put it. And it kind of helps you show that what you're eating is not good because it's kicking you up in the 200 plus range, within 2 hours after you're eating with your glucose in your interstitial fluid. So what is the A1C measuring? There can be several reasons for a spike in blood sugar. It's a good idea to know what is causing yours, but at first it's essential to understand what A1C and what the A1C test actually measures. And you can see here, high blood sugar, high glycemic levels are like white bread, soda pop, ice cream, cornflakes, cereal basically. And then low on the list is like beans, lentils, hummus, and not so much peanuts. Almonds, other nuts are better than peanuts. Any sugar that enters your bloodstream attaches itself to your hemoglobin on your red blood cells. The A1C test measures the amount of glucose stuck to the hemoglobin, like you see here, which provides a good proxy in how much average blood glucose was in your bloodstream over a 2 to 3 month period. Here's an interesting fact. Carbon dioxide has a greater affinity to hemoglobin. So if you're drinking a lot of soda pop, you're going to have a lot of attachment with carbon dioxide. Hence, that's why a lot of athletes, people who want endurance, want more oxygen carrying capacity, don't do soda because that'll affect. And then if you're eating poorly, you also have higher, sugar, glucose stuck to your hemoglobin. Your hemoglobin, the purpose of hemoglobin carry oxygenation through the body. So that's why it's an important thing. And that's why you have inflammation, swelling, and pain in the body because you have low, your hemoglobins are not healthy. And this is why they die in the spleen because they're not healthy. A simple way to remember how to read the results is the higher the percentage, the higher the risk of diabetes. According to the CDC and prevention, less than 5%, 5.7% is a regular A1C reading. Okay, you see it there in the yellow. A reading between 5.7 and 6.4 is considered pre-diabetes, while values above 6.4 is diabetes. And people who are in the between 5.7 and 6.4, they start putting them on metformin. and the 500 milligrams, sometimes extended release, and then you move into Atlantis. Then you move into things like insulin. I can't tell you, that's the last thing you want to do is be on insulin. Just read about that. That's like a death trap. I mean, but they're, it's like, well, your body's not making enough insulin. No, it's because you have insulin resistance, because glucose is there, and your insulin goes and grabs the glucose and tries to bring him into the cell. But if there's a resistance there, the body's like, oh my gosh, we're not getting the glucose into the cell, so we need to release more insulin. That's what insulin does. It's a fat-making hormone. Even if you exercise, it's hard to lose weight, but also cause inflammation in the body, in the blood vessels, especially in the coronary arteries in the heart. So if you're having high levels of insulin, you're going to develop plaquing. And if you develop plaquing, that comes from cholesterol. Remember, 75% of the cholesterol comes from your liver, 25% from your diet. But if you have plaquing, it's because of your diet, because you have too much insulin. Crazy. So everything can be changed with diet. Before you start overanalyzing your results, remember that there are variables at play. For example, the U.S. National Library of Medicine found that adults with a history of diabetes often have A1C levels at 6% or greater. This means not every high test result is a cause for concern. Still, it's worth checking to see consistently high values, because if you do, that's not good. And it's usually every 3 months. High A1C levels lead to impaired fasting glucose and increased risk of type 2 diabetes and cardiovascular disease. Again, because of the insulin, it like literally causes inflammation in the blood vessels, like the coronary arteries, and they become inflamed. And then cholesterol is released to come and lay down a protective plaquing. So cholesterol is like the hero to come to protect the body. But the problem is if it keeps coming, if it keeps being invited to the party up there in your heart, then it closes it off, and then you have lack of oxygen to the heart, hypoxia, not good. So if you do have this, look at this by the numbers, 2 to 3% risk for heart disease with higher blood sugar, 30% of coronary stents and implants increases your risk 30%, $280,000 heart attacks annually, 2 to 4 times higher heart disease, mortality, morbidity, and the chance of dying from heart disease, just because you like white bread, you like pasta. The problem is you live here in America. I have a lot of Polynesians that are patients of mine, and I tell them, you need to eat like you're on the islands, fish and vegetables, but they come here and they eat this American crap, and they don't do well. 8 reasons why A1C came back, even though you're not a diabetic. Number 1, you have anemia. So if you have anemia, any interference with your red blood cells or changes in hemoglobin will falsely skew the results of an A1C test. Anemia, usually caused by lack of iron or deficiency, again, dietary, of B12, B9 is a good example. So again, back to the dietary thing. So anemia, as you can see there, fewer blood cells, fewer of the body's ability to carry oxygenation throughout the body. According to a 2014 study, iron-deficient individuals had higher A1Cs more frequently. Those with fasting glucose saw even more elevated levels. And then then classified by gender, women recorded higher levels, and anemic patients usually have a shortage of healthy red blood cells. So you can see a false A1C values, even though you don't have diabetes. So again, if it's false, you have elevated because you're iron deficient, or you've had a splenectomy. That's the spleen that kind of handles the weak red blood cells. And if it's decreased, hemolytic anemia, sickle cell anemia, or if you had a transfusion. So these are some of the things that you want to look into if you're doing this for your patients. Or you have high triglycerides. Your triglycerides are a type of fat in your blood serving as an energy source for your body. Your body can convert energy. It doesn't need to burn right away into triglycerides, like a storage. Then it uses them as energy source between meals. This is especially true if your diet is high in added sugar. So, I mean, just look at the difference between the two there. I mean, you got a broccoli and a burger boxing it out, right? But who wouldn't rather just have a burger than broccoli? The problem is when your body's healthier, you're going to crave more of that broccoli. Do you know a head of broccoli this big has a potential of 6 grams of protein? So there's people, where are you going to get your protein from? Well, you can get it from vegetables, but you're eating it as amino acids because amino acids make protein. When you eat protein, it's got to be broken down. You don't digest protein, okay? Number 3, you have a kidney disease or related disorder. Those who suffer from kidney disease can find it more challenging to rely on the efficiency of A1C tests. They often see A1C results, according to a report by the Davita, and may not always be accurate. This is because kidney disease can cause complications like anemia and malnutrition. This, in turn, affects the results of A1C. both with diabetes and kidney disease, it can be more challenging to get accurate results. So, and there are some symptoms of some kidney disease. And who doesn't have fatigue, swelling in the feet, swelling in the legs, because of the body's ability to, process blood flow circulation. 4, some medications such as opioids that can cause high A1C. And who's not on opioids? Pretty much almost everybody, right? Several different medications can interfere with this A1C. Some can even cause errors in reading or bringing up inaccurate results. Some opioids and even over-the-counter drugs can increase your A1C levels, according to a study. And common drugs like aspirin can also cause high or low A1C values. So who's told to take aspirin? Like everybody. Oh, you got to take a baby aspirin. If there's any heart complications, anything, strokes, heart, they recommend to take aspirin, which now research is showing that causes more problems. So if you want to find out what aspirin does, daily aspirin, baby aspirin, just because it's a lower dose, they call it baby. Look at the results and what happens if you're still, there's other nutritional things that you can do without having to take an aspirin. If you want to know that, you're gonna have to get a hold of me. I have my number on here. I'll show you later. There's some natural things you can do to so you don't have to do aspirin. Okay. You have disorders related to the spleen? Again, we talked about like sickle cell, spleen, or you can also can affect your A1C. If you think your levels are suspect and you have one of these disorders, that may be the culprit. These disorders render tests less accurate when a patient inherits a hemoglobin variant. And you can see on the body, that's where the spleen is. There's a normal spleen, and then there's an overlarge spleen. An overlarge spleen from infection, lupus, malaria, cancer, cirrhosis, things like basically, malnutrition, the gut microbiome. If you're not eating right, you're going to have problems all over in your body. And the spleen is just one of the things that are going to suffer downstream from what you eat. You have low thyroid levels. Thyroid hormones regulate the rate at which your body burns calories. The number, because you need, your thyroid releases like a T4. The TSH test, thyroid stimulating hormone, they measure that. And that's where the T4 is. And so the T4 is released and it goes and processed through your liver, becomes T3, which is more of a burning T3. But the thing is, most doctors don't measure the free T3 and all that stuff. So they put a patient on levothyroxine, some kind of synthroid synthetic T4. The number of thyroid hormones in the bloodstream can affect your A1C. This will cause the reading to fluctuate or give you a false reading. For example, hypothyroidism or low thyroid hormone levels can lead to an elevated A1C. So we do a lot of hypothyroidism because that could mean also you have candida. You have yeast infestation of the body. And so the yeast candida can affect how the thyroxine molecule tells the cells what to do. And if that's not working, the TSH levels from the pituitary are going to go up. And that's when the blood test comes back. And that's when your endocrinologist puts you on T4, synthetic hormone, for your thyroid. So these are some other ways that you should, if you're going to get your thyroid tested, you should ask for all of those: TSH, free T3, T3 total, T4, free T4, RT3, and the antibodies, the uptake, T3 uptake. All those things are very important, not just the TSH, like the first one. That's what they mostly do. So take a picture of that. If you want to get a thyroid test, that's what you want to ask for. Okay. Or you can get this is being recorded. You can come back and watch it again, like if you can't sleep one night. I'm just teasing on that. Now, you have hemoglobin type C, D, or E. Did you know there are various variants of hemoglobin? It's not common to know your type, but if you're wondering, what's leading to elevated A1C, you may want to check. The most common is hemoglobin A. So just the different types, depending on what ethnicity you are, that kind of a thing. So if you want to maybe check next time you have a blood test, hey, I want to check my hemoglobin. What type of hemoglobin do I have? B12 deficiency. So we have a product. It's called the Sublingual from Solutions 4. It's you put it sublingual. You don't want to swallow a B12. The best way to get it is sublingually. Okay, so you want to put it under the tongue and you want to let it dissolve. That's the best way to get B12. One of the reasons your body needs B12 is it helps create red blood cells. You already know iron deficiency anemia is a cause of an elevated A1C test. Since a deficiency in B12 often also leads to anemia. It's no wonder that it leads to high A1C readings as well. So taking a B12 vitamin can also affect these levels, producing a false low A1C. So you want to have it enough because a lot of people are deficient. But A1C or B12 deficiency can lead to things like infertility, hypothyroidism, depression, cognitive decline, because the B12 is important for nerves in the brain as well. again, low energy, and then numbness, tingling. So that's another a good thing that we do give patients that we're treating for neuropathy is the B12 sublinguals. They're pretty great. All this can be taken care of and reversed when your patients go on one of my programs I've done, like a 20-day rejuvenation, 5 or 12-week program with guidelines for eating supplements. This is not only going to help with pain, weight loss, neuropathy, just feeling better. So that way you're the hero to your patients. You're the one that's like, my gosh, I go to this doctor, he has everything. He takes care of my needs. Yeah, I went in for pain, but now he's taking care of my health. I'm losing weight. I feel better. I don't have any numbness, tingling anymore. I mean, all these things. So I leave that in. It's not my company. I just think they're amazing. So there's a solutions4.com where you can set up your own free account. You can even try some of this stuff. You can even try the B12s. So I've had so many patients get their A1C under control time after time. It's so cool when they come back and go, Dr. Singleton, I got my blood test back. My A1C is back to normal again. I'm like, great. That doesn't surprise me, but it's really cool. Patients really love that because guess what? Their medical doctor, their physician, not going to happen. They don't know how to get back to normal. They only know how to write prescriptions. They only know how to write the metformin. They only know how to write some kind of an insulin, So that's what I do. So I've done a lot of things over the years. You can kind of read that. Not only have I helped over 2,500 clinics, but I also help proactive doctors too. So if you're a proactive doctor, that's why you're on here. But if you have any questions about this or anything else with calls, I'm doing some new things with proactive for calling that's working out pretty good. And so I won't tell you now. I'll tell you maybe sometime down the road. So I'm working with some of the coaches and always Angie, and it's been great. So if you have any questions, there's my bat phone. If you're old enough to know Batman, he had a bat phone. And then there's my email, and there's my singletonsystems.com, kind of what I do, what I coach other doctors, and then the solutions4.com for products if you want to get some products and try them out.